The state of Oregon could be punished for taking too long to admit mentally ill people in jail to the state psychiatric hospital. And it's not the first time. A new legal filing is asking a federal judge to hold the state in contempt of court that could force drastic changes and costly investments. Evan Watson explains the ripple effects rocking Oregon's already stressed mental health system.
Disability Rights Oregon, an advocacy group, is behind the new legal filing, asking a judge to find Oregon in contempt in a legal fight that first started back in 2002. Based on a long-standing judicial order, Oregon is required to admit mentally ill defendants in jail to the Oregon State Hospital within 7 days. These are people ordered by the court to get treatment so that they can aid and assist with their own legal defense. The concern being a jail is not a good place for someone with severe mental illness. The longer someone stays there, the worse they could get. I talked with Disability Rights Oregon's legal director, Emily Cooper, who says there's a human cost to noncompliance.
Every day a person with mental illness spends in jail is a risk that they aren't just deprived their liberty, but they're at risk of losing their life. The past 2 years, we've lost 2 young men who are being held in jail for these services, and I was just talking with one of those mothers, and she wants her son's story and his loss to have made a difference in a system.
In August of 2022, a federal judge issued an order that limited the amount of time defendants can stay at the Oregon State Hospital, forcing the hospital to release patients quicker and open up new spots. That order helped Oregon get in compliance with jail wait time requirements. Before then, people waited on average more than a month in jail before being transferred to the state hospital. After the order, as you can see with that line, average jail wait times dropped below the 7-day standard in 2023 and early 2024, according to the Oregon Health Authority data. But then Oregon had a couple months of high referrals, seen by the most recent part of that line and graph there. The state couldn't meet the demand, and wait times climbed back up to a current average of 27 days.
To not only get in compliance, but to stay there, we've got to fully fund community behavioral health.
There are multiple issues at play here, all intertwined. To start, Oregon needs to expand its mental health capacity. State psychiatric beds, community beds, all of it. An OHA study confirmed that last year, calling for 3,700 new mental health and substance use beds to close existing gaps and meet future projections at the cost of hundreds of millions of dollars. Oregon lawmakers are considering a portion of that. Cooper says Disability Rights Oregon is asking a judge for sanctions to make sure the state invests in its mental health system.
If the state can't find the money to pay for these services, one of the reasons our motion asks for contempt sanctions is they can be in the tens of thousands a day. We can get the money to potentially pay for the system, but it comes from contempt fines instead of being appropriated from the legislature.
To force a hand.
Force the hand.
Cooper and Disability Rights Oregon believe that reducing jail wait times should be top priority, but every action has a reaction. We looked into the clear ripple effects from that shift in priority that started in 2022. Based on the judge's order, the Oregon State Hospital started releasing more patients earlier to make room for people waiting in jails. As a result, the percentage of defendants who were found mentally fit to proceed at the end of their state hospital treatment decreased from 59% to 40%, a 19% drop in restoration, per Oregon Judicial Department data. For the people not fit to aid and assist with their own criminal cases, their charges are often dropped. And then what? With shorter treatment at the state hospital and a lack of follow-up mental health services, this larger group of unfit defendants has committed more crimes within 6 months of their release. Judicial Department data shows a 46% increase in new felony cases and a 90% increase in new misdemeanor cases for defendants who had their aid and assist cases terminated in the prior 6 months. Through public records requests, we got the data showing hundreds of people facing new charges, including murder, burglary, assault, harassment, and many others. Remember, the trade-off for all of this was that mentally ill people wouldn't languish in jail for longer than a week. But as we've seen, even that didn't last long. Ultimately, we are back where we started on the jail wait times, with a system that's now a greater threat to the community and one that's worse at restoring people who really need care and treatment. Judges in charge of mental health courts in Oregon who see these cases year-round recognize this in a court filing in November. They cited the data, saying this is one of Oregon's most ignored crises. It needs to be a top priority, and there are serious consequences for everyone involved. Judge Nan Waller, one of those judges, previously talked with me about this, also pointing to substance use as a contributing challenge.
That's not good for the individual. It's not good for community safety or just the community well-being, that we have people who are very mentally ill using controlled substances in a way that makes their behavior even more difficult, and we can't get them into the right level of placement.
I asked Emily Cooper with Disability Rights Oregon about the ripple effects of getting jail wait times under the 7-day requirement. She said these effects are additional evidence that Oregon needs more places for community mental health restoration. She said she wasn't surprised by an uptick in crime without community care options. And lastly, as we've covered here on the story, the priority on aid and assist cases, the blue line, means that civil commitments are now nearly non-existent in Oregon, the green line. Civil commitments are when a person is forced into treatment because medical and judicial leaders view their mental illness as a threat to themselves or others. Without this option, the state effectively waits for someone with severe mental illness to commit a crime before mandating or forcing care. Based on current space, you need to deprioritize something else, and that would come to civil commitments as one of those things, right?
Yeah, we're in this terrible triage. Who is going to be hurt the worst? So we need to prioritize. I would like us to get beyond this sort of emergency triaging where people can get services when they need it.
Evan Watson joins me now. Evan, awesome reporting on such a complicated topic. I want to talk about what's next if a judge holds a state in contempt, because we know in 2018 a judge found the state of Washington in contempt for not providing mental health services to people in jail. What happened next there? Yeah,
so in that case in Washington, the state was ordered to pay about $200 million in fines for the violations to people who are waiting in jail, waiting for mental illness treatment. In addition to that, the state legislature appropriated about $90 million to take a former hospital facility, purchase it, renovate it, bring it up and running, get it up and running, and moving 70 patients there, all within about 2 months. So these changes, the court-ordered fines and the new money from the legislature, helped Washington cut down the amount of people waiting in jail with mental illness for treatment from about 500 people to 15, getting the state into compliance there. And it also allowed Washington to do some other things, such as less intensive care options and new treatment facilities for people who might not need the most restrictive type of care. All that to say a contempt order caused changes in Washington and forced investment for them to improve their mental health and criminal justice system. So it can be done. There's kind of an example there. It would be interesting to see if that's how this plays out in Oregon.
Do you know when a judge is expected to rule on that filing?
Yeah, the Disability Rights Oregon filing for contempt here in Oregon. There was set to be a status hearing on this big case set for tomorrow. That has now been pushed back a couple of weeks. So I think that and this new contempt filing will probably all be rolled into one. I expect later this month to at least be discussion about this, to say, hey, here's what the next steps, and also what is the legislature doing, and that's going to play a role and come into this as well.
And we know you'll be following this.
Yeah.
Evan, thank you so much.